We are here for our patients. No other reason but for our patients. We take care of the grandmothers, the grandfathers, the mothers, the fathers, the children, the baby, the brother, the sister. We take care of all of them, and the public knows that. So regardless of what they say, regardless of what they put out in the news, the public knows that we are there. We are there in their time of need, and we will continue to be. And we have to fight. We have to fight for them to do a better job, because they're doing a really piss poor job right now. Okay? So stay strong.
I'm Allison Miller. I'm an adult oncology RN at Long Beach Memorial.
So today you guys are protesting. What are the reasons for that?
Patient care safety issues. We are fighting against the working conditions.
Explain all that, please. We don't know any of it.
I sit on the negotiation table, and we've been in a labor dispute with our hospital regarding patient care issues that we can't come to terms with. We need break relief nurses that come in and cover one-on-one patient care. What's happening is right now, standard practice is you have a break cover who comes in and will cover 2 teams at a time. California mandates safe staffing ratios at all times. I can give you an example.
Yeah, please do.
You have an adult oncology floor. California states they should be in a 1 to 4 assignment. That means 1 RN for 4 patients. That's an oncology cancer patient. Long Beach Memorial has some medical patients that overflow onto our oncology unit. So they therefore say that we're deemed a medical oncology floor and run us at a 1 to 5 assignment, which means that you'll have 1 RN for 5 patients. When lunchtime comes around, they cover 2 RNs at a time. So essentially you have 1 RN for 10 patients. So you'll have an oncology patient in a 1 to 10 assignment when the state mandates that they need to be in a 1 to 4. So nurses typically need to have their breaks because they work 12 hours. This is a very long time to be working. And what nurses will sometimes do is forego their breaks. I can't take a break because who's going to take care of my patients safely? Who's going to watch them? They can't cover themselves. We need the patients to have their care continued while we're on breaks.
So
you don't want a nurse not taking a break, because
it actually jeopardizes the patient's life.
It puts them in an unsafe situation. We've had codes where we've had to resuscitate patients during break time when their nurse was on break. So these are very big safety issues. The break relief nurses is something that we've tried to speak to our chain of command. We've tried to speak to our CEO. We've brought it to the table in negotiations, and they're just not seeing the problem. They're not recognizing our issue. Second issue is the lift teams. Again, it's state mandated. You're supposed to have lift assist teams. If you look at the big hospital, we have 2 large hospitals, Long Beach Memorial and Miller's Children's Hospital. We have 4 lift assists. That's 4 people for both hospitals on any 12-hour shift. 4 people, that's your lift assist team. Patients are falling, they're on the floor. When the nurses are calling for help, lift assist to come to help them pick up the patient in a safe manner up off the floor, back into bed. They're saying they're not available. Back injuries are one of the #1 nursing injuries. I'm injured myself, not from a back injury, but just running for a crash car. I tore my meniscus and had to have surgery. Nurses get injured in the workplace. That's why California has a law that we need lift teams. And so Memorial says, well, we have a lift team, but if you look at these large hospitals, they have 4 people. That's what they're calling a lift team. We need lift assist on each floor, present on the floor, so that when things happen and our patients fall, they're there readily. They're not having to wait.
So when Governor Davis was in charge, he made it mandatory 1 to 5 nurse to one
He
nurse?
he passed the Safe Patient Ratio Act,
Yeah.
and the hospitals had a lot of time to prep for that. They knew that it had been coming. It had passed. They had ratios at the first year at a certain amount of time, and then after a few more years into it, they went down to where they had to have more staff to kind of give them a preparedness. Okay, by this year, this is how you're going to staff, and by this coming year, you're going to have even more staff, because they knew that it would require for the hospital to hire more nurses so that they were no longer breaking the law.
What do you guys want?
We want break relief nurses who continue patient care when the nurses are on break.
So this is not about pay increase.
No, it's not. The hospital really focuses on that. They are very much aware with the monies. Ours is for the patient. So all these nurses out here, they're out here for the patients. They'll tell you so.
Any last word you want to give?
I want our employer to settle the contract and give the patients what they need. But this is a fight for the patients. It's really for the community. They need to have safe care at all times.
May I ask you one more thing? Your
Yeah.
contract. Has your contract expired and now
Yeah, right now we're working without a contract, but we're still negotiating.
how long the negotiations been going?
We started in July. It's been a long labor dispute.
So
And this was like the last thing we wanted to do. We don't want to be out here. We've only called a one-day strike. The hospital is punishing us and locking us out for 5 days.
that's without pay. Is that
Oh,
it?
without pay. That's without pay. Now listen, if it was about pay, would the nurses be out here? You see what I'm saying? You're not being paid to be out here. It's not about pay. Nurses out on a strike line aren't out here about wages. They're getting locked out for 5 days. If it was all about the money, they'd be working inside. The nurses working inside are working inside for the money.
The IBW is here today. We'll be here every day it takes till they get the message. The nurses deserve a fair contract. Not only the IBW, the building trades, the entire LA Federation of Labor, 120,000 strong, support the nurses